Dr. Sujit is also here.
Hello, everybody. Welcome to one more webinar from Indian Society of Bone Marrow Transplant. This webinar deals with how to prevent and handle caregiver burnout. Next slide, please. I thank the webinar sponsors, that is Genova Biotech. Next slide, please. The webinar is generally conducted with the help and support of the members of the patient support group, that is Dr. Venkatesh, Dr. Silki Jain, Ms. Riya Dharuwala, and Ms. Suman Kubal, and myself. Next slide. And we also are grateful for the support of our mentors, Dr. Naveen Khatri, Dr. Revati Raj, Dr. Jose, Dr. Sharad Damodar, and Dr. Dinesh Burani. Next.
3, 1, 4,
And
5, 5, 6, 3.
And we thank Mr. Raghu Rajgopal, who is Executive Advisor for ISBMT, and Jolly Thomas, and Rashmi Mundana for your support in the background. Next. So today we have Ms. Niharika Bhatia, who is a Senior Manager at RGCI, who takes care of the transplant at RGCI, who is the speaker who will talk about the caregiver burnout. Before that, I request Mrs. Sangeeta to just give a preliminary introduction. Mrs. Sangeeta Koyal is a mother and caregiver of one of the bone marrow transplant patients and has keen interest in this area.
Yeah, thank you so much. My name is Sangeeta Koyal. I'm residing in Bombay. My son, who was 17 years old when he went through bone marrow transplant at Narayana. So as of now, he's fully recovered. He had his dream of going and studying in Canada, which also got fulfilled thanks to the bone marrow transplant, which went off successfully for him. As I understand what it is to be a caregiver, and I think that is why I think Raghu gave me this opportunity to be able to moderate this session. Thank you so much. Over to you, Dr. Santosh. Thank you, Dr. Santosh.
Thank you, madam. I hand over the stage to Niharika Bhatia, who is a Senior Manager in the Department of Hemato-Oncology and Bone Marrow Transplant at Rajiv Gandhi Cancer Institute and Research Center, Delhi. Thank you.
Hello, good afternoon, everyone. So I'm here to give a talk about how to prevent or handle the caregiver's burnout in bone marrow transplant. Mostly we talk about the patients all the time, patient support, how patients can be, supported with the good care, with all the information. But the more important role is of the caregiver. So we'll see how they are important. What is the role of a caregiver during the BMT procedure? They are acting as an interpreter, obtaining all the information from the doctor and then, transcribing it to their families, organizing everything, including their appointments, pre and post BMT, and juggling the needs of immediate and extended family members. They sometimes work as a clinician also, identifying the changes and have to be vigilant for their patient, as BMT is a long, prolonged hospitalization and requires intensive immunosuppression and potentially life-threatening complications. So they have to be there and being strong.
Niharika,
for everyone.
your slides are not seen.
Okay.
Request you to share the slides.
Just a second. So I shared it and then are they visible now?
No, ma'am, still not.
Nirav, you can put the deck for her.
Yeah, just a
When you need to change the slides, you can indicate.
Yeah, sure.
If there is a network issue, Niharika, you can put off your camera.
Yeah, we can see the slides, Niharika.
Okay, perfect. So should I start from the beginning?
Go ahead.
Okay. So we were talking about the role of a caregiver during the BMT procedure. The caregiver works as an interpreter, involving all the information from the physician and then transcribing it to their families, to the patient. They have to make them understand each and everything about the transplant procedure and what is the prognosis of the disease. And they are organizing the medical appointments pre and post BMT and juggling the needs of immediate and extended family members. They are working sometimes as a clinician also, assessing and identifying changes in their patients pre and post BMT and staying vigilant for their patient as BMT has a prolonged hospitalization, intensive immunosuppression, and potentially life-threatening complications. So being there and being strong for everyone, and they are still finding balance in uncertainty during the hospitalization. Next slide, please. So what is a caregiver's burnout? It's a long uncertainty, waiting and waiting and waiting, and long, prolonged time. But it is not a weakness. It's actually making them more stronger to come out of this uncertainty. And what is unique about the caregivers of BMT is the isolation. The patient is undergoing a long isolation period, but the caregivers are also together going through that social isolation, since they have to be inside that HEPA filter room for a month or so. And then post transplant also, they have to be meeting less people due to infection handling and everything. Emotional fatigue, as they are there with the settling down the emotions of the patients, physical exhaustion, and the poor quality of life. Next slide, please. So why caregivers matter? It's like caregivers provide 70 to 80% of the supportive care outside hospital in many cancer settings. They are with the patient 24/7. Due to different advances in the treatment of the cancer and the cost containment measures, they are more now vigilant to take care in the home. So long-term immunosuppressions and the BMT complications have to be handled. Infections during pre and post BMT. Nutrition is so important as that helps to fight the cancer. And the emotional journeys, they are actually the invisible supporters to the successful outcomes. So there has been reference papers where it has been seen that the caregivers who actually took the responsibility right pre BMT and during BMT till the follow-ups, there was an increase of survival and 3 times more better outcomes for the patient, for the BMT patients. Next slide, please. So the unique stress which they are facing is not only physical stress, they have to be there with the patient all the time in the BMT, in the hospital, during the post-transplant complications, but mentally and emotionally, they are there with the patient, as well as the social isolation. So they are isolated from their extended family members, from their kids sometimes, from their elderly parents sometimes. So all these put the big strain on their mind. Next slide, please. They are relocating, the families are relocating. Someone is moving from north to south, someone is moving from east to west. Sometimes they have to go internationally. And then there is a financial burden, which is the most demanding thing for them. These are the challenges. And there is sometimes, they have a loss of income as they are not on duties. Their businesses are being hindered. They have to sell their house for the treatments. And the family expectations also arises, as sometimes the patient is a kid and the sibling is at home. So the patients and the caregivers are there in the hospital, and there is a long, prolonged hospitalization in the hospital, which requires frequent visits. And so the challenges are many. Next slide, please. So before transplant, they are the decision makers, and it is the toughest decision which they have to do. There comes the pre-BMT phase when the transplant physician, when the managers, the counselors, the nurses, the pharmacists, everyone has to make things clear for the caregivers. More and more of information when given to the caregivers, it completely ensures and builds trust on the hospital. So they can only trust, and then they can, be a little stress relieved about these things, that yes, one day their loved ones will come out of the hospital and will be discharged and have a good outcome. So counseling is as important as chemotherapy. Next slide, please. BMT phase is actually the preparedness to ensure the medical management. Everything is about, it's not a surgery. So everything is about the medical management. It's a scary phase, but the trust ensures everything. Awareness of isolation. So yes, there will be an isolation for a long period of time, but everyone will stay connected. We tell patients to do video calls. We tell them to stay connected through meditation, through yoga. And then the caregivers are actually there physically. So the physical exhaustion is so much that the spiritual power is very important. So the power to stand for your loved ones mentally, emotionally, physically is becomes more important. These things actually turn worse things to better and then eventually to good. So it takes a long time, but the faith and the trust ensures everything. Next slide, please. Post BMT phase. So post BMT phase is as important as the BMT phase since it's more about managing the complications and being aware about the GVHDs, graft versus host diseases, some infections since the patient is in neutropenic phase, and the medications, round the clock medications, the immunosuppressions have to be measured and the levels have to be changed, and the clinic visits then they have to do also the routine work so that everything is ensured financially, and then the emotionally they have to be linked with their extended family members. Next slide. So being there and being strong for everyone, it is actually very easy to say, but yeah, the hiding emotions from the patient is very tough for the caregivers. Caregivers take all the load, extra load, and then they take it on themselves so that the patient and the family members are relieved. Caregivers of children sometimes doubt their parenting as they find that they might have done something wrong, or why is this happening. These questions come in their mind, but then they need constant guidance and more resources through this tough time. So caregivers, they often smile in front of the patient, but they cry outside. And we know these things as we meet each and every day with the caregivers, and whatever things they are going through, we counsel them, and that is more important. Next slide, please. So finding balance is like you have to be connected with your friends, connected with your family. You can take out time for meditation and yoga, which has shown proven results. Psychosocial counselors are very important. So psychosocial counselor, everyone is thinking for their patient that the patient should have a counseling. Why not caregivers? Caregivers should also have a counseling before BMT and during BMT. Everyday changes are so important with the caregivers. So proper sleep, proper exercise, nutrition, and faith, of course. Next slide, please. Preventing the burnout. How can we prevent the burnout? We have patient support groups here also. In our hospital also, they come, they meet each other, and they counsel more and more number of patients who are coming next for the transplant. So they meet the caregivers also. They sit and have a cup of tea, and these kind of small little programs will help them surely in the long run. They connect with each other, and they don't only talk about the treatments, but they talk about what hobbies they have and what they can do for further, in including everything spiritual, or say meditation, yoga, everything. So psychosocial counseling is very important, and everything is being kind to them. So being kind to the caregivers, and compassion and empathy should be there. So sympathy is not what they require, empathy they require. Next slide, please. How can hospitals help? So caregivers program should be there. So we talk about the warrior program for the patient, and I feel that caregivers are actually the super warriors since they are there 24/7. So every kind of support they require, financial support should be from the hospital, from the all the team. The BMT team is there all the time. We connect them to the social workers. We connect them to the state funds, to the national funds, which Prime Minister Fund. And then there are several NGOs these days who are working hard to help them to manage their little things, making them aware and educating them So all these things should be very transparent. A transparent communication between the hospitals and the patient and the caregivers is very important. So helping them and through their philanthropy services and then the social work is very important. Next slide, please. So supporting caregivers throughout the BMT journey. So BMT is a long procedure. It's not about only a pre-BMT, post-BMT phase. Then there is a long post-transplant follow-up of 1 to 2 years till the time they get a new life. So just like a small kid is getting a new life when he or she is attached to the womb, it's similar like the cancer patients are getting a new life, and this new life is actually making them more stronger. So caregivers are also getting a new life from this post-transplant or transplant journey of their patient. So there's an uncertainty with continuous guidance and reassurance and realistic expectations. They should be, constant in touch with the transplant team, with the hospital, and we should assess their well-being as well, apart from the patient. So if we are scoring a patient about their what is the score before transplant, we should have a score of the caregiver. So to be with them, we have to identify who can be more stronger inside the transplant unit, post transplant unit, who can help the patient to come out of this very well. And we should provide them timely, transparent information to build their confidence and reduce anxiety. And we can develop a comprehensive family centered care plan to ensure smooth transition and improve outcome for both the patients and the caregivers. Next slide, please. So it is all beyond medicine. The caregiver's well-being is important. Their adherence to the patient's treatment. If some caregiver is not taking responsibility post-transplant, what will happen? And then they have certain other responsibilities. Then it is a little bit challenging for the patient as well. If we will have a better recovery if the patient comes out with a responsible caregiver, and we'll have a better outcome as well. So when we support caregivers, we strengthen the entire transplant journey. We should support them so that the transplant journey is not like a big task for them. It should be like whatever they have been coming, or they are knowing this, the treatment is like this, the complications will be this, they'll come out more stronger. Next slide, please. Behind every transplant survivor is a caregiver fighting silently. So we should care for the caregiver, and thus our patient will be taken well care of. Thank you for the patient listening.
Thank you, Ms. Niharika Bhatia, for that detailed introductory talk on caregiver burnout. I now request Ms. Sangeeta Koyal, who is a mother and caregiver, to take the stage for the panel discussion.
Thank you so much, Dr. Santosh. Firstly, let me, we have all heard Dr. Niharika Bhatia. Let me tell you again, she's a senior manager at the Department of Hemato-Oncology and Bone Marrow Transplantation at Rajiv Gandhi Cancer Institute and Research Center. She's amongst our panelists. Another esteemed panelist we have is Dr. Sujit Kumar Mullapalli. He's a consultant in the Medical Oncology Department of Apollo Proton Cancer Center, Chennai. We have Ms. Supriya with us, Ms. Supriya Nyandev Kana Bahadur. She's a nursing officer. And then we also have Dr. Savita Goswami, who I think plays a very big and important role, as we all heard, as a psycho-oncologist. She's a part of Department of Psycho-Oncology at Tata Memorial Hospital. So I welcome all the panelists, and let me just quickly tell you, I am a mother of a son who had been through a bone marrow transplant at age 17. And I understand what a caregiver goes through, because we had to do most of the things that Niharika ma'am had explained in the slides. Most of the things we have been through, everything was experienced by us. But what really made it a little more easier for us is because me and my husband both shared the responsibility of a caregiver. So it became much easier for us. Our doctor was kind enough to allow that. But I know in a lot of cases, because I saw other mothers, they have small children, so they can't expect the father or any other adult to come and look after their child if it's a 3-year-old or a 6-year-old, and so many other financial factors which obviously matters. We did not have that issue as well, but still we went through a lot of these things that Niharika ma'am said. So if I can just start the panel discussion, I'd like to start with Dr. Sujit Mullapalli. Hello, doctor. Good afternoon to you. What role, doctor, do you think your team of physicians and coordinators, nurses, psychologists, dietitians, or even the social workers who are involved sometimes play in supporting the caregivers throughout this whole journey, according to you?
Namaskar, everyone. It's my great privilege to be here among all of you, the doctors, the caregivers, the transplant team members who have come together to discuss a very important topic, a much important but not yet discussed topic about caregivers. I think I completely agree with Ms. Niharika. Caregivers are much more important than many times the doctors in the journey of the patient. I often tell them that the empowerment of caregivers automatically makes sure that there is compliance to treatment, there is compliance to the precautions, there is compliance to what we are advising them, so that the outcomes are always influenced. And often, as it's mentioned clearly, it's a silent support. So the first thing I think as doctors we should do, and many times we forget to do, is to recognize and appreciate the role of the caregivers in the journey. That itself gives them a lot of confidence in their role. They should clearly understand that we appreciate them. We realize how much important they are in this journey. So that's one thing that every team member of and transplant team should do. Now, the thing is, as mentioned, the counseling before treatment is very important. I think the most important thing they want is information. If you give information before the treatment, how is it going to happen? And during the treatment, especially during the treatment, there are situations where things may not go as we have planned. There might be delay in engraftment. There will be some infection that is coming on, which was not explained or which was not expected. So the wait outside the ICU or the wait outside the BMT is going to be very difficult if they are not having the transparent information. So as doctors, as team members, as coordinators, information is very important, especially transparency, what is happening. Even if it is not going the way we want it, we have to be informing them. Second thing is that a medical social worker can help become a big bridge in the team, because many times the doctors, the caregivers are not very confident to open up about what is happening financially or physically. Maybe there is something else happening in the family. They are not able to say, and that also gives a lot of burnout. So a medical social worker in the team should be given the guidance that please be the people, please be the caregivers person in the team. Ask them how are you, ask them what is another problem financially. They are very much open to the care coordinator or the medical social worker in the team. So the doctors should be giving that what you can say, that guidance to the medical social worker, that please find out what is happening regarding their finances, regarding any other issues they want to communicate to us. Then I would say that many times they neglect their physical health. We have seen, as rightly said, especially if they are in the BMT, everything is about the patient, every care is taken, but what is happening to their diet? I would say each hospital should have a 24/7 canteen, especially for the caregivers, that they don't need to go out of the hospital in odd hours to have their food. Many times I have seen, if we ask them, did you have your food? They just, many of the times they were not had it, and asking them, telling them it's important. This is a long journey, 3 weeks or 4 weeks it may take during the treatment BMT. So you please don't neglect, especially husband and wives, mothers and fathers. No, they are ready to give everything. They don't realize that it's a long journey. They can't get sick during their caregiving process. And fourth, I would say that space is very difficult in many hospitals, but if we have a small room for them to pray, for them to meditate, for them to do yoga during this journey, because there is no night and day for them. Anytime there might be a requirement for a blood, there might be a requirement for a medicine, they are always available. So if there is a space for them, it will be very important. And most important, finally, I would say loneliness is called as a mental pandemic. I think many of our caregivers go through loneliness, especially I would say husband, wife, and parents. They do go through loneliness, and mental health definitely suffers. So actually, many people, when we discuss about meditation and yoga, they feel it's a big thing, or it's a thing that is only for some selected few. But it's not like that. Meditation now, because it's a digital world, it's available in apps. You can have apps for meditation, and there is an app which I routinely use, which is called Miracle of Mind. It's a 7 minutes meditation app, Miracle of Mind. You just need to download, and then wherever you're sitting outside a BMT, you are sitting in the canteen, wherever you are waiting, you can just use it for 7 minutes. It's a voice guided meditation called Miracle of Mind app, which is which is very useful for a 7 minute meditation. I think from doctors and all, because I am representing the team which you have asked, we have to recognize them, we have to appreciate them, and we have to empower them. And just our talk may not be enough. We have to focus on their nutrition, their mental health, their physical well-being, and I would say some digital tools like Miracle of Mind or any other app of meditation will be very useful. Thank you so much for the listening.
Thank you, Dr. Sujit. So you have talked about empowerment and leading to compliance. I think that's a very important takeaway from your answer, and you know how important it is to be ensuring that the patient caregiver is adequately informed. You also have been empathetic enough to say that they should have a 24/7 canteen and should be able to help. We should be able to. Your team does help in terms of how they manage themselves and their mental health. Thank you so much. Next, I would I would pose this question to Ms. Niharika, though your presentation was quite detailed. But you said that, you know, information should be given to them. What kind of information, like even Dr. Sujit said, what kind of information about the treatment, Ms. Niharika, do you think should be shared as a given to the caregiver, so that, you know, there is less stress, they're better prepared for the BMT or even pre-BMT or even post-BMT for that matter?
So the patient comes to us for the pre-transplant phase, first of all, and we try to do the counseling. So that's the first step. We do the counseling about staying inside the BMT unit, as well as post when the patient gets discharged, what all precautions have to be taken. So there is a team of our nursing team here at our hospital, and they also do a counseling for the parents, for the elderly, for the even the young patients who come. So they tell each and everything, right from the infection prevention, and also emphasize about the precautions they should be taking, rather than fear driven. So it's not about being, all the time getting too much cautious about the hand hygiene and the medication adherence or the safe food practices. But timely reporting of everything is very important. So we try to calm them down, and trying to create a completely sterile environment is not possible. But then what is important is them is to have isolation, and then this isolation will be temporary, which will be later on, resolved after the patient will be doing well. And so we have to make them understand that this is the time when you have to be just be with yourself. The caregivers and the patient is together in a room, and the transplant physicians, the nurses, the coordinators, all are there to help them. So they are not there to, they might be families will feel that, we are just another patient, but it is not true. It is they are each and every family is important for us. So each and every family should be treated in a way that behind everything they should feel confident, and they should trust the surroundings. They should trust that wherever they are in a right place, and that kind of things we try to help them. Medically, doctor is explaining each and everything to them. We do the consenting, in which everything is told about the transplant procedure, the complications. But psychologically, what things has to be understood during those times is much more important. That makes them more stronger. It is like a positive growth for them. So they come out stronger after this. I still meet the families and then who have already gone under the transplant, and they come and then they are really, you know, when we see their happy faces, it's believed that the pre-counseling was very essential. So the pre-counseling is important about the treatment and about the uncertainty which they are facing, so that they can, you know, just be less stressful.
So I just want to add to this. One of the things that helped us when you're doing the counseling and you're talking about this, I think what also helps is some amount of information or some amount of guidance as to how they can even have their home front while they're not around.
Yes.
Manage so that they don't have that stress at home. So whether it's another child at home or whether having some kind of a support system at home, do you think that
Yes.
works? That also is something which is included.
Yes, yes, that's so true. That, you know, the things back at the mind, whatever is happening at home, there the other kid is there, maybe an elderly parent of some patient caregiver is there. So they have to think about each and everyone. So that's why peer support is very important, right? So the friends
Yes.
and family, the extended family members should come and then they
Correct.
should help them. So they should ask for help. It is
Yes.
nothing like they should not talk about this. They should more and more talk about these things, and they definitely, everyone, you know, the positive things all will come around.
I think what has struck with me is ask for help. I think a lot of people do not realize they need to ask for help. So thank you so much, ma'am. You talked about counseling and you talked about how you are keeping them informed and also ensuring that they take care of their mental health before even they get into this. Thank you very much. My next question would be to Dr. Savita. I can't see Dr. Savita.
I'm here.
Yeah. Oh, okay, doctor. So, doctor, you play a very big role. What physical and behavioral changes really do you observe in a caregiver? I think during it would be mostly during the BMT. That kind of gives you like a alarm that this caregiver is now going to kind of fall apart, or because once that person falls apart, then it's really going to impact the whole procedure for going further. So what do you observe when you are there?
First of all, thank you, BMT, for this invitation. Thank you, everyone, for this opportunity. And thank you for the question. So as both the speakers have already very nicely mentioned about the challenges, about the long stresses and the kind of role caregivers are playing in the whole process of BMT. As most of the caregivers, they are nowadays being a nuclear family, there's lack of support, and there are multiple other challenges being away from home. They multiple times face that fatigue and exhaustion, and there's lack of rest that is commonly seen. And most of the time, they feel that probably if it is a husband or wife or parents, they feel only I can take that good care, and therefore the whole responsibility is taken and there is no boundary to that. So there's sleep disturbance, there's headache, there's muscle cramps, there's back pain. So many physical complaints are there. They always get some or the other infection, like skin infections, or they will complain about acidity, or complaints of weight loss. These are seen very commonly in most of the caregivers, and they just go on, they pull on, the constipation, diarrhea. And in along with all of this, they also taking care of the patient, doing all the procedures, running around, gathering funds, doing all the investigations. So in all that, personal hygiene and self-care is neglected, and that leads to lot of or multiple physical issues, which also lead to behavioral issues, like because you don't have enough stamina, you're so fatigued. So then कई बार केयर गिवर्स को बहुत जल्दी गुस्सा आ जाता है ना, दे बिकम इरिटेबल, लैक ऑफ पेशेंस, थोड़ी थोड़ी बात पे गुस्सा होना, चिढ़ जाना, दे कांट होल्ड देयर इमोशंस, और देयर इज लैक ऑफ इमोशनल कंट्रोल, बहुत जल्दी रोना आ जाना. Family, because many times there's lack of family support, or sometimes just because you don't want to share things, because that is everything is so overwhelming and you don't want to give burden to others, people withdraw from family, friends, or probably they have expectations, but according to their expectations, they are not getting support. So they withdraw from family, friends, and there's lack of time. They are so invested in the whole process. So there's lack of social activity and there's a lot of engagement other than the treatment related stuff. So then there's no relaxation. There's always something or the other playing in on their mind. So difficulty in concentration, attention, and the process is such that they have to take difficult decisions at this point. Many times there's recurrent infections or some other things which need some decisions where they feel incompetent to make decisions. So these are some behavioral changes where they themselves sense that probably I am not competent enough the way I was before. I am not. So that brings a lot of lack of confidence and questioning about their own self-esteem.
Yes,
So
I can completely relate.
yeah. And then what happens multiple times, things which are not in your control. Suppose like the financial, the gathering those funding and creating the atmosphere which you want. Sometimes it is not in your control. So you feel helpless most of the time, and you feel that probably I don't have much control on my life. So that helplessness bring worthlessness also. And people then become more and more disappointed with their life. They feel life is not meaningful and I didn't want to live this life. So this brings lot of emotional burden. So there's persistent anxiety is यानी कि बहुत सारी बेचैनी हो जाती है, घबराहट होती है, what will happen next to my patient, what is my life in all these things. These kinds of questions are always there, meaning of life. And even the small amount of stress can create lot of burden. So that perceived stress is quite high because the capacity is less, because you are so overwhelmed with the responsibility. And all these, as you said, that what are the red flags when they should take counseling. So these things I think very important for everyone. मतलब केयर गिवर को भी ये पता होना चाहिए, नर्स को भी ये पता होना चाहिए, डॉक्टर को भी ये पता होना चाहिए that कब actually the whole process, pre-BMT, BMT, post-BMT, at every point counseling is important. And counseling is not just counseling by psychologists, but every professional's communication is very, very important. That information provision and clarification, everything is important. But if the patient is continuously, persistently distressed for more than 3 to 4 weeks, and you can make out that is not sleeping, not eating well, then that person should be referred to a psycho-oncologist or somebody who's available. Every hospital sometimes doesn't have psycho-oncologists close by in the near vicinity, but somebody who can give that professional guidance. Moderate to severe anxiety, depression is sadness. बहुत बुरा लगता है, sad लगता है जैसे मेरे लाइफ में कुछ बचा ही नहीं. Sometimes you feel like you should end your life. There's nothing meaningful happening, and probably there's nothing ahead in my life. इससे कैसे बाहर निकलेंगे? And you feel as if you are trapped. And in that sense, such ideas can really be very harmful. The people can self-harm, they can go into substance use. कई बार लोग शराब पीने लग जाते हैं because they don't know what to do, what will give them some relief. So they start smoking, they start drinking. Sometimes the depression is so high that people just close themselves. They are so isolated, lonely, as the doctor has already mentioned. So all these kind of distress can be definitely obvious to people who are seeing them regularly during consultations, during their appointments. So this should be picked up very fast and they should be referred. Also, there are conflicts, conflicts with professionals, conflicts with family members. They're getting irritated. They have opinion differences because they really don't know how to make decisions and how to control their emotions. These things also can be picked up very fast. And therefore, they should be referred on time and they should be then given appropriate interventions.
Also,
I
if I can just add to it, because again, it's मेरा experience ये था कि कुछ ऐसे trigger points होते हैं, जैसे कि BMT के वक्त GVHT हो गया, या फिर बोन मैरो ट्रांसप्लांट 2 हफ्ते में उसका इम्पैक्ट आना था, वो 3 हफ्ते हो गए, 3.5 हफ्ते हो गए, पेरेंट इज एंशियस, या अभी पैसे भरने का टाइम है और द क्लाइंट द केयर टेकर or the caretaker support system is kind of getting anxious about it, and these are also probably some of the signs that you might be observing from what you're telling me, and or rather you might have to be proactive at that time to help them out so that
exactly.
Yeah.
So we really have to anticipate many times, like doctors and nurses, they are quite aware, they are seeing this frequently, so we know the triggers, so we have to be proactive.
Yes. आपके कंधों पे और आपकी टीम के कंधों पे बहुत ज्यादा रिस्पॉन्सिबिलिटी है इस बात की, एंड इट्स नॉट इजी, आई एम श्योर अबाउट दैट. I just like to now address Miss Supriya. Miss Supriya, you are, I think in the nurses team and probably even managing the nurses. How is the environment made conducive for the caretaker to easily give feedback or share their concerns or ask for help? I just would you to throw some light.
Everyone. First of all, thank you ISBMT team, patient support group for organizing this important session, and special gratitude to my hospital institute and my nursing in charge and the BMT team. As a nurse, I think that in the bone marrow transplant journey, caregivers are important part of the healthcare team. They always we always tell them that they are not just attendant, they are our partners in patient care, since they spend a maximum time with patient there, and their observations and feedback are extremely valuable to us. As a nurses, we try to build trust from the day one. We introduce ourselves, we greet them, maintain a friendly and approachable attitude so that they can reach out to us easily. So we usually tell them कि आपको कुछ डाउट है क्या, कोई टेंशन है या कुछ समझ नहीं आ रहा है तो प्लीज हमसे पूछिए, डोंट हेजिटेट, बिकॉज समटाइम्स दे थिंक दैट सम क्वेश्चंस आर सिली, व्हाई शुड वी आस्क. छोटा हो या बड़ा, वी टेल देम दैट हर every question is important to us. So many caregivers hesitate to ask the questions. So what during our daily rounds, what we do, we ask about the patients also and we ask about the caregivers also. So how was your day? How are you? आज आप कैसे हो, आज आपने मैनेज कैसे किया, तो कुछ दिक्कत तो नहीं हुआ मैनेज करने में, या कुछ टेंशन है आज आपको, यू आर लुकिंग वरिड, इज देयर एनीथिंग वरिंग अबाउट यू. Sometimes these simple questions are enough for them to open up. So when they feel, sometimes they tell us, when we talk to them, we try to approach them. So they may come to us and say they are feeling exhausted, anxious, and confused about some medicines. So we identify these concerns early and we provide our timely support to them before they become burnout. The another very important thing is that active listening is most important for some caregivers. So sometimes caregiver don't need a solution, they need a some person so they can share their feelings to them. So they just don't need someone to listen without judging them. So we patiently hear them out, acknowledge their feelings, and explain things in a simple language instead of making complicated. We also ensure them, if you are not okay, it's okay to tell us. We are there to support you. Not only for the we are there for the patient, we are there for the caregivers also. सो अगर आप इमोशनली टायर्ड हो या थोड़ा आपको ब्रेक चाहिए, तो आप हेल्प मांग सकते हो अपने रिलेटिव से, फ्रेंड्स से. तो ये आपको बताना है कि आई एम इमोशनली टायर्ड और आई नीड अ ब्रेक. सो सब कुछ अकेले हैंडल करना जरूरी नहीं है. वी ऑल्सो नीड समटाइम्स हेल्प. We encourage them to immediately inform us, because always relatives are there with the patients. So we encourage them to immediately inform us if they notice any changes in patient conditions or any medication problem is there. So any concerns they are regarding. So their timely feedbacks help us to detect the problem early and we can provide a better care to them. When we carefully, when the caregivers feel heard and respected, we also involve in the decision making also. So they become more confident and less anxious. So this open communication builds both a trust between us and the caregivers, which strengthen the partnership between a caregiver and a health worker team. So we always tell them, so we are there for you. For patients also we are there, and for the caregivers also we are there. Thank you, ma'am.
Oh, thank you so much, Supriya ma'am. I think you guys are in true sense life coaches, because when you said active listening and without judging, that's something which a life coach is literally trained to do, and you're doing it so seamlessly. I think you talked about asking questions that before even asking questions, I said, I want to tell you my experience that one of the things that happened was all the nurses took my permission and said, can we pray for your child? You know, when that BMT was supposed to commence, we went into the ward and he said, you know, today the BMT is supposed to happen, so can we pray for him? So I think, like you said, you connect and you ask questions, you show that you care, and that itself is a very big thing for the patient and the caregivers to feel connected with you and trust you to be able to share. And you talked about timely feedback, which is also very, very critical, because then only certain proactive measures can be taken. Thank you so much for sharing this with us. Coming back to Dr. Sujit, I would ask you this question. What advice would you give the caregivers who are struggling with uncertainty, fear of relapse, and prolonged recovery period after transplantation? So sometimes if GVHD happens, or that the transplant is taking a little while longer, these are the examples that come to my mind because of my experience. So, doctor, if you could just throw some light on this.
It's very difficult at that point of time to really tell them what may happen, but we many times at that point of time go by what has happened in our experience and what has happened as far as the literature goes. So again, I think most important thing is to be transparent about what we know and what we don't know, rather than a blind word that everything will be all right, or a statement that everything is going to be bad. No, we don't have much hope. I think that two statements cannot be justified in such situations. It's about listening to them actually again. They may have their own questions, which actually which I have learned, as Santosh sir said, from my mentor, Dr. Naveen Khatri sir, that it's about listening and just being there. They just want us to be saying that, yes, we are still in that path to recovery and we are giving our best, and then answer their questions. And I think most important thing would be to daily counsel them, the every day, morning, evening, if possible. There should be a time for them where they are allowed to be with the doctor and the team completely without any phones or without any distractions. And if things are not going the way we want it, still, it's, you see, the always we always know that when a patient goes into a BMT, he or she is actually very fit. Unless they won't go into that BMT if they are not fit physically. They may be in a transient period of remission. They may not have a long remission, but they are in a period of remission where they are fit for the treatment. So when they go into the BMT and they develop complications, sometimes there is a lot of struggle that happens, even for the doctor's team. I would say we have all gone through that phase where we also, we don't see them as patient. I would say many of the time they become part of our, no, as a family we see them. So the first thing I would say, anytime, whenever a doctor or a team member is going to discuss these things with the family, the most important thing I would say is to work on ourselves. As doctors, we should have a mental stillness, a mental, what you can say, peace. If we are ourselves disturbed about what is going on inside the BMT and we go with that mindset to the patient, we may cause more confusion. The patient will sense that the doctor is much more, no, much more disturbed than we are, and they may not open up. So I would say the doctors themselves are going through a lot of stress. They should invest their time in yoga and meditation, or some sort of team ways to empower themselves so that they are able to handle these uncertainties. Otherwise, they are going to cause more harm than giving them a positive confidence. So I would say both for the burnout, for the doctors and for the family members, I personally do meditate and I have seen it really helps. And I would say that stability is important for us before we do anything outside. So if you have to summarize, one is our own personal goals of self-care should be there for the doctors and the team in BMT. Second thing is transparency. What we know. What we don't know, we accept we don't know. And third is we should not ever break the hope, in sense that we should never, you see, there might be a situation where everything is clear in front of our eyes, but till we are trying our best, we need to understand that they are not scientific people. They just are hanging on to our words. We should choose our word very wisely, still be truthful to them. That is what I would say.
Thank you so much, Doctor. I think, yes, like you said, it's difficult, but what you know and what you don't know, if you can clearly and honestly tell the caretaker, then it is always better. And I think what you said was very, very important, that the doctor needs to be looking at, even if he's not, but he needs to be looking like he's in charge and he's kind of, mentally there and strong, so that it kind of reflects and gives a lot of comfort to the caregivers and patients that, I'm in good hands. So thank you so much for sharing this with us. Ma'am Niharika, I would like to ask you this question. What support does the hospital BMT team provides in terms of avoiding stress, of financial especially, and emotional burden? Do you have some kind of a program or something that is being shared with them? And I mean, at what stage it happens and how do you do it?
Yes, bone marrow transplantation is not just medically demanding, but emotionally and financially overwhelming. So, since the BMT team comprises of a multidisciplinary approach, we at our center, we try that, we provide continuous counseling to the caregivers and regular communication to reduce the anxieties. Then we have dietitians, we have nurses, we have psychologists, medical social workers who support together to, working for the family. Financially, we guide them for the insurance, if they have regarding insurances, if they have any kind of patient assistance program. So there are various patient assistance program these days in the institutes, and we put them to the medical social workers who guide them further. For the government health scheme, first of all, we talk with them. That is more important. The day the diagnosis is there, we have the diagnosis, the treatment has to be started. We should inform them about the government health scheme. So this will ensure the time lapse. So there will be plenty of time to apply for those funds, and then getting the assistance in the time when we need it. And there are various charitable trust NGOs who help, and also we have a few like the patient support group here. The patients who have already been treated and who you see, some people have money, some don't give money. So some people, they have money and they want to give money to the needy people. So we have a little group of these donors here who are helping and donating funds for our patients. So it is going all in the various departments inside the hospital, not just in the hemato-oncology, and it's going in the medical oncology, it's going in the surgical unit as well. So there are donors who are donating money for the patients' families. And
Nice.
for the sometimes if we don't have money for testing and all, we try, we can take help from them. We have a petty cash over there, so we try to help them with that also. So this way, I think we can help them, like load off their burden of finances. Then
you must be aware they are aware of these crowdfunding options also, right?
Yes. Crowdfundings are there, and we guide them for that. We connect them to the crowdfunding organizations for that.
That's nice. Thank you so much, ma'am. Really, I'm sure it helps the patients and caregivers and their families. Ma'am Savita, I wanted to ask you this: when and what kind of when, I think you answered somewhere in the previous question, but what kind of counseling really works for them? Any particular, is it one-on-one? And I don't know.
Actually, there are multiple specialized evidence-based psychotherapeutic techniques which most of the psycho-oncologists are practicing. And this is one-on-one and also in a group session. So, as most of the speakers have already said that listening is important, communication is important. So, active age-appropriate communication, then empathy, also having unconditional acceptance of their situation rather than being, biased or having our own mindset about this. So, if with all these therapies are practiced where patient and caregivers conditions are kept in mind, and this is their agenda, this is their situation. I may be knowing loads of situation, and I had very good experience with other patients, but this caregiver is different. So accordingly, case by case, seeing the situation and giving them appropriate coping strategies, I think that helps a lot. And in this, there are techniques like psychoeducation which help them to work with the situation. So there is a lot of information load, and everyone is doing for the good sake. Like doctors are explaining, nurses are explaining, but this is leading to a lot of uncertainty and fear. Most of the information which is coming regarding the procedures and a lot of disease-related information. So how to process this, how to look at the here and now, what is happening currently, how we can go step by step, all this teaching them, giving them new perspective to look at that situation. Sometimes it is totally dark and negative, but within that also, what is in our control, what we can do and go ahead at this point, teaching these things and helping them, by empowering them with different coping strategies which actually they are practicing in other situations, and learning from their own life that you have faced so many other challenges, so apply these things here also. So these things are taught them by using evidence-based therapies like cognitive behavior therapy, where patient who is fearful and suddenly thinks that probably my life is gone, there, if you introduce the idea that not everything is not gone, because everyone is there helping there with you, so how can everything is gone, we can work together. So changing that approach, changing that philosophy at that point and moving ahead with the situation, that helps a lot. But this needs sometimes more follow-ups, more commitment to this. So empowering them with that, and basic things which we can teach them to deal with is self-care, because once they handle their own health, then probably they can manage their emotion, they can manage the other stressors. So as doctor said, that sometimes they have not even eaten, they are fasting most of the time. So teaching them small things that suppose there is no canteen, but carrying 2 bananas. So this is not a big counseling thing, but addressing at appropriate time, and teaching them to carry a small diary, which will help them to organize their day-to-day routine, because now there are so many things in their mind and there is load and they're forgetting. So how to be flexible, how to be adaptable, and carrying that feeling that I am playing important role. Many things are out of my control, but still I am playing important role, and I can make some difference to my patient's life. So that positivity helps them. Teaching them sleep hygiene, that will also help them by teaching different relaxation techniques. So when they come to,
So I think what you're saying is, it's right from telling them to be better equipped to take care of their physical and mental health, to even how to handle the dark parts of the treatment where you have no hope and you kind of are really falling apart. I think you and your team must be really having a big job there, because it's not everybody who can really stand up to the reality and say, okay, this too shall pass. It's very tough, right? So I think it's a very, very important role that you play and your team plays in this. So it's definitely, I mean, I can't even imagine what it is to be in your shoes. Thank you so much, ma'am. Unless you want to add something, do you want to add something? Sorry, I interrupted you.
No, I was just saying that it is a comprehensive thing. It is not
Yes.
just one thing, but
Yeah.
there are multiple domains. So it is multidisciplinary also. So psycho-oncology is not working in isolation. It is
Yeah.
working in collaboration.
Correct. Yeah. Thank you so much, ma'am. Thank you, really. Thanks to you and your team. Ms. Supriya, how can the nurses in the BMT staff provide support to the caregiver? So one of the earlier question was very similar. Let me see if I can. How do you really ensure that the caregiver is proactive in terms of handling his and her emotional and practical challenges that they would face during the transplant, because you are the ones who are actually with them during the transplant. And like Savita ma'am said, you need to understand what is the time at which point you need to tell the doctor or guide the caregiver to kind of finally go and seek counseling. So how do you guide them while you're talking to them?
Okay, thank you, ma'am, for the question. So we think that bone marrow transplant is not only challenging for the patient, but for the caregivers also. It is most challenging for them also. We understand that the caregivers are managing so many things like medications, infection precautions, how should they take, hospital stay, financial concerns, and sometimes dealing with their own emotions also. So that's why, as a BMT nurse, we believe our role is not only to care for the patient, but also to care for the caregivers. The first thing we do is to educate them, not only by giving instructions, but we make sure that they understand what we explain. Everything we explain them in their simple language, that whether it's a hand hygiene, catheter care, medication, how to give medications, what are the timings, so what diet should we give to them, what oral care should be taken, infection prevention, how, and the most important, warning signs, what warning signs they should see and need a immediate मेडिकल अटेंशन. सो वी ऑलवेज टेल देम कि आपको एक बार नहीं समझ में आया तो कोई बात नहीं है, आप हमें 2 बार पूछ सकते हो, 3 बार पूछ सकते हो, हम फिर से आपको एक्सप्लेन करेंगे. जब तक हम केयर गिवर्स कॉन्फिडेंट नहीं हो जाते कि तब तक वी विल एक्सप्लेन यू दैट दे विल फील कॉन्फिडेंट दैट वी विल सेफली केयर फॉर देयर लव्ड वंस. द अनदर इम्पोर्टेंट थिंग इज कम्युनिकेशन. वी एनकरेज केयर गिवर टू आस्क क्वेश्चंस फ्रीली. सो कुछ भी डाउट हो रिगार्डिंग मेडिकेशन या कौन सा डाइट लेना है, इज दिस गुड फॉर माय पेशेंट, ये प्लीज हमसे पूछिए. सो दे वी एनकरेज देम टू आस्क द क्वेश्चंस, नॉट along with the educations we give to them, but emotional support also. So we tell them कि it's completely normal कि आप stressed out हो या worried हो, आपको ऐसा लग रहा है कि पेशेंट्स अभी रिकवरी नहीं अच्छे से हो रही है या GVHD हो गया है, तो इट्स नॉर्मल. तो आप जो भी फील कर रहे हो बिल्कुल नॉर्मल है. डोंट डोंट स्ट्रेस्ड आउट योरसेल्फ. तो आप याद रखिए कि हम आप अकेले नहीं है इस जर्नी में. वी आर देयर, डॉक्टर्स, नर्सेस एंड आवर होल BMT टीम इज देयर टू help you with it. This simple conversation helps them to express their concerns. So, and there are the additional supports also. We can connect you with them also, that is like dietitian for the nutrition guidance, doctors are there to treat whatever concerns are with the medical. Then with the psychologist will give you the emotional, whatever emotional stressed out you are feeling with, so it will help with them. And the medical social workers for the financial and the practical assistance. We make sure that they don't manage single everything alone. So we make sure that this is a team. We are managing the patients and the caregivers. So not only we are managing, then we ask with the simple words also. We ask them, आज आपने खाना खाया क्या? How was your day? Did you manage it? Did you manage it well? Then for us, the support is not only giving instruction; it's also walking this journey together. We want every caregiver to feel that we are there for you. We respect their feelings, that they are confident enough to support their loved ones and also maintain their feelings also.
Do you have, add on, do you have any kind of a frequently asked questionnaire, questions that, a list of that available to the patient? Because, I mean, to the caregiver, because it is, everybody must be asking you sometimes very similar questions. So do you have any such kind of a list that you provide to them?
Yes, ma'am. In our institute, while giving the instructions, we are having a specific questions that this instruction, this time for this type of care should be given, this diet should be followed, how the environmental hygiene is important for them. So this type of questions. So we give instructions 3 times. That first 2 times we explain to them in the simple language, in Marathi, Hindi, or English also, whichever language they are comfortable. Then at the third time we we tell them to what you have understood. So at third time we know that this portion is not understood by them, so we again try to explain them.
All right. Thank you so much, Priya ma'am. Doctor, I wanted to ask you, Dr. Sujit, you had mentioned about yoga. So do you have any such program for your doctors, and for even sometimes do you have some kind of a yoga, teacher or somebody who comes and gives some kind of a session to a caregiver before they even go into the BMT ward? Because if they don't know, maybe within the BMT ward they can practice. Do you have some kind of a thought like that, or an idea, or something that you are already practicing?
So we have what we call as ISMP YMO group. It's a medical oncology youth group. And from the last International Day of Yoga onwards, we have started a monthly online program for the doctors. It's called Joy, that is Journey in Oncology with Yoga. So we have a monthly online program on 4th Sunday from 6:30 to 7:30 in the morning on Zoom platform, where the patients, caregivers, doctors, nurses, everyone can join online, and we have a simple meditation program for that. And this meditation is actually available in an app. As I said, it's called Miracle of Mind. It's a 7 minutes thing. So anywhere people are waiting or sitting, we say don't wait but meditate. So that is one thing we say. So that is one thing. I see everyone says about the time. Whenever we discuss meditation or yoga, everyone says हमारे पास तो time नहीं है. So that is the thing, 7 minutes. And there has been a study from NIMHANS which says that 7 minutes of breath watching and meditation can make changes in the brain waves. They have done an EEG study. They said that the alpha beta waves actually become normal. The EEG waves become pleasant. That is, they become slow and calm and relaxed when you do a 7 minutes of pranayama. So I think that is one thing we have to invest. It's a very simple thing. It's on our own empowerment. So I would say that has helped for us in terms of burnout, and that is what I advise the patients also, that at least you do this many 7 minutes a day is not a big deal. So I would say that is what we are doing, and national level we are doing it in for all, and say is an open access Zoom link. So that is what we are doing, ma'am.
Definitely, I'm sure it helps, because I wish I knew it at that time. I did a course later on, much later on in life, about yoga. But what really helped me was chanting. I pray, so I chanted. So whenever there was a lot of stress and there was something that I couldn't manage, or I couldn't manage myself, I just chanted in my mind. And I remember my son getting irritated with me about me chanting while he was in tremendous pain. He had just finished the chemotherapy. And
I'll
I
share
just
that
told
link,
him,
ma'am. I will
yeah,
share that link with Santosh sir. Sir can share it with the ISMB,
Sure.
yeah,
ISMB
please,
members.
please,
Yes,
please.
yes.
Definitely, it will help. Definitely, it will help. Thank you so much,
Sangeeta,
doctor. Yes.
Sangeeta ma'am, just one thing I wanted to add. Along with meditation and yoga, सब लोग अगर अपना अपना पैशन भी कंटिन्यू करें, अपना कुछ भी छोटा मोटा हॉबी है, if you continue that during this
Yes.
time when you are sitting outside the ward and when people are in isolation, that time I think this will really help.
Sure, sure. Listening to music, for that matter.
Yes, something
I think it really would help if people love music. And like I said, and
Yeah, ma'am. Actually, we did a study in our chemotherapy unit, which was called music study. So during the treatment, 30 minutes of it was an app called AI designed app, where based on their inputs, there was a 30 minutes of music, and 50% of the patients said they had a very good pleasant experience, reduction of, we had a pilot study, so it was presented in ASCO also. So
Yep.
music definitely works, and it is useful.
Sure. I mean, I could see my son going to sleep. So initially when he got irritated and when I told him, I'm just chanting for you, he said, okay, continue. He let me be. And when I did that, it helped him sleep. So after that, I still remember he called me from Canada once to say that, you chant, because in that state also he could go to sleep just because of the rhythm or whatever, that vibration of the chanting. And I think that's true for music also. Thank you so much, Dr. Sujit. I think if the caretakers can understand the benefit and really follow through, and I'm sure your doctors must have seen some benefit of it. And I think it's important all hospitals follow this, because yoga has been something which has helped and has been an ancient understanding in our country. Thank you so much. I would have just one or two more questions. Niharika ma'am, does
Ma'am,
sir.
Sangeeta ma'am, we are really running short
No,
of time.
okay. Thank you so much, sir.
It was super enriching, and we really learned quite a bit from all of you all. Dr. Sujit, Niharika, Sangeeta ma'am, yourself, and Savita Goswami. And Savita Goswami was actually my counselor when I was taking care of my mother at Tata Memorial Hospital. So I really, the 10 minutes I spent with her was really life changing. So to just share my experience about caregiver burnout. And Supriya, thank you. I'll hand over the stage to Ria Daruwala for the end finishing comments.
I would just like to quickly thank you everybody for giving me this opportunity. Yes, ma'am.
Thank you.
Hey. Hi, good afternoon, everyone. So on behalf of ISBMT Patient Support Group, firstly, I'd like to thank Ms. Niharika Bhatia for such a practical and insightful session on managing something like caregiver burnout. Also, thank you to our moderator, Ms. Sangeeta, who really managed this session well, and to all the panelists, Ms. Supriya, Dr. Savita, and Dr. Sujit, for enriching today's discussion with all your insights and experience. Most of all, I think we need to thank all the participants who have been, engaged and listening very keenly. So thank you for being present again, and to our partner Genova for supporting this. And we look forward to seeing you again next month for our patient support webinar. Take care and see you all.
Thank you.
Thank
Thank you.
you.
Thank you.
Thank you, ma'am.
Thank you, everyone.
Thank you.
Nirav, please stay back once everyone leaves.
Yeah.